In this video, we will pull strings together to help you learn about pathophysiology as well as signs and symptoms of Paget disease. Skeleton is a framework of bone which protect vital organs of the body and help us move. Let's look at cellular level of bone. Mature bone cells are termed as osteocytes, which make up 90 to 95% of bone. Cells which make new bone are osteoblasts, while those which eat up bone are osteoclasts. They both make 5% of bone and responsible for bone remodeling. Now, we will discuss about origin of these creatures. Some mesenchymal stem cells are converted to osteoblast precursors, which are further differentiated into osteoblasts. Osteoblasts are responsible for production of MCSF, rank L, and OPG. MCSF stands for macrophage colony stimulating factor. Rank L stands for receptor activator of nuclear factor kappa beta ligand, and OPG for osteoprotectant. These factors are known to regulate osteoclastic activity, but let's see how. Hematopoietic stem cells are converted into monocytes under commands of MCSF. These circulating monocytes, when reside in bone tissues, they become osteal macrophages or osteomacs. Hematopoietic stem cells also convert into osteoclastic precursors because of MCSF. These precursors, when bind with rank L, become activated osteoclast. Rank L initiates while OPG stops apoptotic activity of osteoclast. Monocytes can be converted into osteoclast precursors by activity of rank L. Now let's jump in to see what's happening in bone remodeling. First of all, quiescent phase. Here, there is no bone resorption and formation. Osteoblasts produce rank L, which binds with rank receptor on the surface of osteoclast precursors or monocytes, and convert them into multinucleated osteoclasts in their activated form. Hence, we call it activation phase. Osteoclasts then release collagenase enzyme and HCl to demineralize the bone. As a result of this demineralization, calcium is released in bloodstream and can lead to hypercalcemia. Activated osteoclasts resorb bone. After removal of old and worn-out cells, the next step is bone formation. Activity of osteoclast is reduced when osteoblasts release OPG or osteoprotectant, which binds with rank L, stops bone resorption. Osteoblast takes the charge as captain of ship and begins to form osteoid, which is organic matrix of bone comprising collagen and mucopolysaccharide mainly, as well as osteocytes, which are mature bone cells. Osteoid is then mineralized to form bone. Now, let's hover over Paget disease. We can categorize pathogenesis in 3 stages. The first one is lytic stage. Here, osteoclasts are culprit as they are highly activated and overactive, which depicts enhanced bone resorption leading to osteolysis. The second stage is lytic plus blastic stage. Osteoblasts sense this imbalance and try to cope up by producing new bone rapidly, along with the accumulation of collagen and fibrous connective tissue. The third stage is blastic or sclerotic stage. Here, bone formation exceeds bone resorption. Too much hurry and rush of coping mechanisms by overacting osteoblasts make excess bone in a disorganized fashion, which is abnormally large and dense but fragile, and more prone towards deformity as cells are fixed haphazardly and fracture easily. Dormant phase with reduced cellular activity is termed as burnt out Paget disease. Paget disease can damage any bone of skeleton, more commonly bones of skull, lower spine, pelvis, and longer bone of extremities such as femur. It can be monoostotic, affecting single bone, or polyostotic, affecting multiple bones. It can affect a part of bone or the entire bone, but it does not spread from bone to bone. Well, it's time to explore about signs and symptoms. Paget's disease is usually asymptomatic. Only 5 to 10% develop symptoms. Signs and symptoms suggesting Paget's disease include bone pain, bone deformity, warmth over an affected area, Bone pain features are severe pain, night pain, pain resistant to analgesics, and burning and deep pain. Bone deformities include bowing of legs, kyphosis, which is a condition in which spine in the upper back has an excessive curvature, lower limb muscle weakness, and pelvic asymmetry. Pelvic asymmetry refers to asymmetric pelvic alignment with respect to vertical axis. Warmth over an affected area due to increased blood flow in the hypervascularized new bone, which in turn increases local skin temperature. Complications of Paget disease include fractures due to weaker bones, osteogenic sarcoma, but it is very rare, advanced arthritis in joints who are neighbors of affected bone, renal stones due to hypercalcemia and hypercalciuria. Neurological complications are also seen, but they are very rare and include loss of sensation or movement due to cranial nerve compression, as nerves get compressed by disorganized and enlarged bones, deafness, vision loss, spinal stenosis, which is a condition characterized by narrowing of spaces in spine which exert pressure on nerves leading to lower back pain. Last but not the least is spastic paraparesis, which is weakness and stiffness in the leg muscles.